Hey, thanks for staying with us as we talk about people with developmental disabilities. We turn next to students with special education needs. The pandemic forced a change in routines, and that is never, ever a good thing for children with certain disabilities. Ed Matthews knows this and sees this firsthand. He's the CEO of Adapt Community Network. That's an organization that works to level the playing field for both children and adults with disabilities. Mr. Matthews, welcome back to In Focus.
Thank you, Cheryl. Nice to be here.
Yeah, so, we have a lot to talk about, but I want to start with education because you are concerned, as are so many of us, that while all children have suffered from not taking in-person classes, it's really affecting developmentally disabled children far more harshly because there are things that just cannot be done remotely. And you say these students are at risk of losing an entire year. Explain why.
Well, as you know, Cheryl, special education involves any number of disciplines, not only education, but also speech, occupational therapy, psychology, and all of the other clinical disciplines that children of that age need in order to get to keep up with their non-disabled peers and to be able to be educated with them in regular kindergarten and school. Now, last March, when we broke for the pandemic and everything was remote, at least we had 6 or 7 months with the children who were here at the time to be able to do things remotely. And while it was a scramble to get parents and others the technology, at least we were able to do things with children that we knew and get parents to do things at home that we already knew these kids. When they left us in June and July, and we had a whole new cadre of children coming in, or at least of 3-year-olds, we didn't see them, we didn't know them. We had to do all of their evaluations remotely. And then while there's been off and on in-person instruction with some of our schools and some of the schools throughout the city, the amount of social distancing that was required and the amount of various red zones, yellow zones, and green zones that happened with various schools cut down, we've not had the opportunity to be consistent with these children.
Yeah, and to your point, this is a critical time for preschoolers. What can be done to recoup what's been lost during this entire school year?
Well, there's been a lot of talk about keeping children past the age of 5 and not having them go to kindergarten. But that too has got a lot of problems with it because the more children you keep in your school, the fewer seats you have for children coming out of early intervention or other children that need it. So there has not been a good solution yet. We're scrambling that through the summertime we'll be able to keep some of the kids longer so that they won't be so far behind. We're praying that in the summertime that everyone will be back full time with fewer. The CDC now is saying, for instance, that they're about to implement a rule that puts social distancing in education programs at least down to 3 feet. So that's going to literally double the amount of children that we're able to have in some of our sites. And so that's going to be very beneficial if that happens even between April and August to do some catch up. But to be honest with you, it's going to be a while before that levels out.
Yeah, we certainly hope they compensate for what's happened over the last year. Now, your organization, Adapt, works with adults as well as children, and COVID has meant that both groups, children and adults, have lost the help of home health workers, and these vital services are everything to people with disabilities. Now, organizations like yours have tried to step in and compensate, but that's expensive and it's also very difficult. And now, I don't know if you've heard the rumors, I talked about this with another guest, that the new budget may recommend cuts to programs that serve the disabled. How devastating would that be?
Well, for the hundreds of organizations throughout the state of New York, it would be very devastating, particularly for those for whom we provide lifetime residential programs. There's been all kinds of proposals by the state, by the very state agency that's supposed to be doing the oversight and protection of these folks, that there'll be cuts coming. And of course, the governor had, previous to the American Rescue Plan Act, that, they were saying, well, the state has no money and we have to do equal things. And, I don't get into the political debate about what was and wasn't equal. But at the same time now, with both the federal stimulus, the American Rescue Plan, as well as some additional Medicaid dollars coming into the state, the likelihood of those cuts is slightly less likely. But at the same time, we're forever watchful, because folks living at home who with developmental disabilities have had very little intervention, very little socialization with peers or anyone else for over a year now. So we're really scrambling to try to make up for that.
Yeah, it is a scramble. And it's also a scramble to get them vaccinated. Give us an update. You have boots on the ground, of course, when it comes to all of this. How would you rate the vaccine distribution for people with disabilities?
Well, it was interesting. Governor Cuomo put people with disabilities at the front of the line, and we have to give credit where credit is due. And the governor's office was very good about putting the people with disabilities, and particularly those with developmental disabilities, at the front of the line. But for a long period of time, it's much better now, but for a long period of time, the amount of vaccines available, was much as it was for the general public, much less than the demand. And the other thing we're facing, we have a lot of the same cultural biases and other biases that both staff and families have with getting the vaccine. But for people with developmental disabilities, their comorbidities, even though it suggests that they should be that they would benefit most from the vaccine because they would be harmed most from COVID, there's still an inordinate amount of fear that we're dealing with out there, that of people fearing that the vaccine is worse than the disease. So it's a scramble. But the state and the city, particularly the city Department of Health and Mental Hygiene, has been very, very helpful in getting information out and getting access to vaccines.
Okay, Ed Matthews of Adapt Community Network. Appreciate what you do for people who need you now more than ever. Thank you for your time.